All right, before I head out, I did want to take a few minutes and go over some tips and instructions to help you recover over the next few days. Now, I have no expectation whatsoever that you are going to remember everything that I'm saying. You may not remember anything at all. That's okay. I've already anticipated that, and I have sent a written handout to your email with everything I'm about to say, so you can revisit it. I actually recommend you get some sleep, get some solid rest, and then after you've done so, go ahead, open up your email, give it a read, but don't worry too much about trying to remember everything. Your main priorities obviously are going to be getting lots of rest, having warm, nourishing foods, and staying nice and hydrated. And of course, bonding with your little baby. I recommend trying to stay in bed as much as possible. I like the rule of thumb, 5 days in the bed, 5 days on the bed, 5 days around the bed. I want you to remember that your body just ran a marathon. Your body did a lot of work, and it has a lot of healing to do. And I know you are healing from some sutures, so I want you to avoid the stairs. If you must, use them once. So get yourself situated in wherever you think you're going to want to be, whether that's like downstairs, in the living room, or upstairs in your bedroom. You do have a really nice setup here where you have your bathroom just right around the corner. Whatever it may be, I recommend you get yourself all situated there. Get some snacks, have a good water bottle, any chargers you might need for your devices, anything you might need for your baby close by, and then just have your partner or your mom or whoever do some things for you. Go get some things for you if you need them, okay? Second thing is I want you to remember to sit like a mermaid. It is really easy, it's almost instinctual to kind of sit cross-legged when we go to hold and feed our babies, but I want you to think about being a little mermaid and keep those legs closed, just so we can encourage that healing process to go as smoothly as possible. On that note, I also want to make sure that your partner or someone is awake and aware if you need to get up in the middle of the night to go to the bathroom. I just want them to be aware that you're going to the bathroom, and I want them to stay awake until you come back to bed. If you're feeling lightheaded, dizziness, ringing in the ears, whatever it may be, I want you to sit down right away, no matter where you are, okay? If you're on the toilet, I want you to move onto the floor. Your bleeding is gonna feel like a really heavy period, okay? That's normal. It will start to slow down and change as the days and weeks go on. It'll start going from like a bright red to a brown, and it's normal to pass clots, especially if you've been sleeping or sitting for a while and then you go to stand up. That's totally normal. However, if you are getting clots about the size of an egg or about palm size, that's not normal. I want you to call me, okay? If you notice that the bleeding is kind of slowed and then out of nowhere, it kind of speeds up and it's bright red, not normal. Give me a call, okay? Usually if you notice that the bleeding is increasing, you know, it's a sign that you're doing a little bit too much, that you've been on your feet too much and you need to get back down and rest. So just remember that your body is going through a lot and you're going to need to rest. Get as much help as you can. Make everyone do all the things for you, okay? Wait on your hand and foot. If you can always check on your uterus yourself. It should be a couple fingers below the belly button, maybe 3. You can kind of feel around 4. It'll be hard. It'll feel like a grapefruit, nice and firm, and that's how we want it to feel, okay? If it doesn't feel firm and it doesn't feel like a grapefruit and there's some accompanying signs, you'll let me know, okay? Other things to look out for you, a fever is 100.4, not 104, 100.4. Okay? If you're getting chills, flu-like symptoms, if you're getting any uterine pain, not just like after birth cramps, but like some sharp, intense pains. And if you notice that your blood and discharge has a foul odor, call me. Any chest tenderness associated with chills and fever, call me. Any pain in your calves, sharp pains in your chest or your abdomen, severe headaches, anything like that, give us a call right away, okay? And honestly, even if you just feel off and you're not sure, call me. We're still on call for you. So if you have any questions or concerns, you're not going to be a bother. You call us, okay? Even if that means we walk out of here and 5 minutes later you are concerned and you have a question, doesn't matter. You call us, okay? It is normal to feel swollen and tender, especially because you did have a little bit of tearing. So I want you to make sure that you use that peri bottle every time while you pee. It'll really help eliminate some of that burning and initial discomfort. The good news is our vaginal tissues heal very quickly, and you should start to notice a huge difference in about 72 hours. I recommend ice only for the first couple of days. 10 minutes on, maybe once an hour if you feel like you need it. But just keep in mind that the ice packs are not absorbent. So if you're filling a pad within an hour, front to front, side to side, with that non-absorbent ice pack on, take it off, put a new pad on. Make sure you're not filling that pad front to front, front to back, side to side within an hour without that ice pack, okay? Obviously, if you're filling a pad in an hour, call me. It's also normal not to have a bowel movement for a couple of days. It's also normal to be afraid to have your first bowel movement. Stay hydrated, eat some fiber. Totally fine to take some stool softeners, magnesium, things like that, okay? When it comes to how you might be feeling, we like to think of around day 3 as the wet day. Basically, everyone is wet. Everyone's crying. Your milk is coming in, so you might be leaking. Baby's crying, because we like to call it the grieving period, where your baby is realizing that they do not get to go back into the womb, and they have to work for their food and to poop and to be a human, and that's hard. And you also will be experiencing, a variety of emotions, and it's normal to be really emotional. You're going to be sleep deprived. However, if you notice that you're not feeling better after getting some sleep, having some food, having some water, and getting some support, that can be a warning sign. You call me, okay? When it comes to feeding, I do want you to try and feed at least every 2 to 3 hours, especially in the next 24 to 48 hours, okay? I recommend it be closer to the 2 to 3 hour mark. If baby's sleeping, I feel comfortable with you maybe trying to push it to 4, but not past that. Wake that baby up, get that baby fed, especially when you're trying to let that milk come in. You will start to see some wet and dirty diapers within the next 24 hours or so. The poops are still going to be that dark, thick, sticky, tarry. Some olive oil in the diaper can just kind of help get it off a little bit easier. Olive oil isn't gonna harm the skin. When it comes to any warning signs for baby that you need to look out for and call us, if you notice baby's having a problem breathing, now irregular breathing is normal. They're still trying to figure it out. However, if you notice that they're grunting, their nostrils are flaring, their ribs are kind of retracting and pulling inward, if they look gray or blue in the face, if they are showing any signs of a temperature outside of a normal range, which would be anywhere from about 97.5 to 99.5. If they're not waking to feed and they're really lethargic or they have a high-pitched cry, call us right away, okay? When it comes to temperature, skin to skin, always the rule of thumb. When it comes to dressing baby, I recommend putting them in a layer more than what you're wearing. So if you're just wearing your pajamas, put baby in like a little onesie and then maybe swaddle baby. If you have any issues feeding, sometimes it can be adjusted with position. So make sure, you know, the baby is facing you. Bring baby to you. Don't bring yourself to baby. I don't want you to hurt your back. If you notice that they are, if you notice some nipple tenderness, that's normal. But we don't want you to be experiencing any pain, redness, tenderness upon the touch. Ultimately, we have some really, really wonderful lactation consultants who can come to your home and work with you if you have any concerns that can't be adjusted with like positioning. So if you have any concerns about feeding, you let us know right away, okay? We are going to be checking on you in 24 hours, but again, we're on call for you. So if you need us at any point in time between now and then, there's no need for you to hesitate, okay? You call us. You're doing amazing. You know your baby already better than we do. We trust you. Get some sleep, and you know where to find us if you need us.